Lynn. Good afternoon, everyone. Welcome to the next webinar we're doing with Liz from Terra Firma 360 about the coronavirus health and safety and staying safe in these uncertain times. There are a few people still joining, so I'll just let those in as we wait for a moment, because there's a couple of people still coming through, and I'll continue to let them in. So Liz and I have known each other for a number of years now, and she is a partner of the Office Management Portal. And many of you have probably seen her at our office management events as well, so hopefully she's a familiar face to you. If not, then welcome everybody that's new to these webinars on the platform. We can share more information about it afterwards if you need anything. Liz and I, primarily Liz, are going to talk to you today about the coronavirus and items in terms of health and safety actions that you can take in advance of going back to the office, things that you can do now, and then open up for any questions. If you want to post a question at any time, feel free to use the chat button. You've got a raise your hand option on Zoom as well, and then at certain points we may decide to unmute the lines and check in on you, and we'll do that at the end as well. Okay, over to you, Liz.
Right, hi everyone, thanks for joining the webinar. We've got quite a lot to get through. We're going to do the questions and answers at the end so that we can stay on time. If we run out of time, we're going to give contact details or maybe stay on the line for 10-20 minutes, depends how busy everyone is. Right, okay, so let's go on to the first slide. Right, so just a little bit about me, won't bore you too much. So I'm a health and safety professional. I've been in health and safety for 18 years. I work with multiple industries, including corporate, construction, manufacturing, warehousing. I've worked with some very large companies like Marriott, Sodexo, Transport for London, to name a few. I specialise in different bespoke services to clients, policies, audit, risk assessments, training, etc. And I'm a chartered member of IOSH, so that means I've been approved by a panel of my peers so I can provide competent health and safety advice. So today we're going to go through a number of different things, just basically based on the questions that I've been getting from my own clients. Some people that are on the webinar have also asked some questions they want covered. And they break down into two categories. So the here and now, what's going on, if you're still operating, and how things are working out there, your legal requirements, home workers, people that are still travelling, and what you need to be doing about your buildings, if you have a building. And for the future, so this is a bit more uncertain, but I can only talk about how we could probably plan for the future and the health and safety requirements to do so. Right, next slide, please. Right, okay, so the first thing we're going to do is we're just going to talk very briefly about health and safety legislation and some of the news that has come out. I'm not going to list all the legislation and regulations that apply to coronavirus because we're not doing an exam and we just need to know what we need to do. So, what we're going to talk about is actions to protect your workforce and business, finding the correct balance, which is a very tricky question at the moment, and enforcement. And that's talking about the Health and Safety Executive and environmental health. Right, okay, so, oops, no. Hannah, all right, okay. So, basically, the actions to protect your workforce and business, there's several pieces of legislation that require for you to look after your workforce. So we've got the Health and Safety at Work Act 1974, which we'll have a brief look at in the next slide. We're going to also talk about management of health and safety regulations and how that covers risk assessment and safe system of work. Now, risk assessment is really the key to a lot of this. and I will talk about risk assessment and reasonably practicable. The Health and Safety Executive has got a great site, and they've got a coronavirus hub. If you haven't looked at it already, put a link at the back of these slides, which will be sent out to you, so you can also look there. So the Health and Safety Executive released a statement recently. If anyone hasn't heard of it, it's called RIDDOR. It's the Reporting of Injuries, Diseases and Dangerous Occurrence Regs. And that's if there are a death or a serious injury on your site, then you have to report it to the HSE. Then there's workplace diseases, and there's also a bit about being infected with biological contaminants. So they've said that if someone contracts COVID-19 due to your work activities, then it's reportable. A lot of people go into a state of panic over this. I don't think it's going to be very easy for anyone to prove where someone contracted COVID-19. But it doesn't mean that there won't be prosecutions in the future. If we look at things like TfL with the bus staff, the NHS workers, they've all been sadly affected by COVID-19. There's a potential. But this brings me on to the best way to protect your business at the moment. A lot of people have taken a lot of good actions. We're all sitting at home. A lot of people are working from home now. There are considerations that will have to be taken into place. So a risk assessment, if you have 5 or more employees, it's a legal requirement that you do so. A risk assessment can also be a good action plan for you to look at what you're doing and plan more for the future. It can also be used in legal defence as a way to communicate with your employees and just sense check yourself. Okay, so the problem people are finding with risk assessment at the moment is what is the right thing to do? What is reasonably practicable? And that is all the law asks you to do, reasonably practicable. So basically it's doing the sensible thing. It's making sure that you balance the benefits of what you're doing, you know, your activities and the control measures. So it's time, cost and effort versus the potential outcome. So by reducing the workforce being in a workplace, one workplace, for example, is reasonably practical considering what the outcome could be at the moment. So there are other things to consider with it. So with reasonably practical, some people justify it with reasonably practical that if they don't carry on operating the way they are, they'll go out of business. That wouldn't be considered reasonably practicable at this time. There are various defences with health and safety. There's one called social utility that a gentleman was telling me on a barber webinar the other day, where people can carry on working if they believe that, you know, their actions are a lower risk than the actual threat they're dealing with. So say there was, I don't know, building collapse or a huge fire, the fire brigade would still go in and deal with it because it is a social utility, it's a necessity. It's like people still going into care homes. But in the case of offices and various construction projects, etc., it might not be deemed as a social necessity. So risk assessment is difficult. There's a lot of guidance out there. People tend to be following the guidance, but not all situations fit everyone's scenario. Now, with all law, you have your legislation, like the Health and Safety at Work Act, but the guidance is an interpretation of the law. It's not necessarily legally binding. But what they do say is if you don't follow the guidance, you need to demonstrate by risk assessment how you satisfied the control measures, how you made sure that people were safe in an alternative way. Okay. If you haven't heard of it already, any decisions you make, I would also refer to the COVID Act that's out right now. It's on the legislation.gov.uk. Hannah, can we have the next slide, please? Right, I'm not going to go through the entire of the Health and Safety at Work Act 1974, but I've highlighted in blue just the main points. So it's quite difficult when you've got remote workers, or you haven't got a fully utilised building, or you've got people out on the road to do all of these things. So I'm going to try and help cover a few of these parts. So provision and maintenance of plant and systems of work, provision of information, instruction, training and supervision. Any place of work that's under the employer's control, so it's maintenance of it, the condition, etc. And the provision and maintenance of a working environment for his employees that is safe. And I can have the next. Where reasonably practicable. So again, it says reasonably practicable. So a lot of people have got home workers at the moment. We're going to just cover different aspects of this, so accidents in the home, electrical safety, mental well-being, display screen equipment. So with display screen equipment, I've had a lot of questions about the health and safety and people using display screen at home. And the HSE have put on their guidance that you don't necessarily have to do a DSE assessment for short-term home workers. However, they haven't actually clarified what a short-term home worker is. So, my interpretation of that would be that if this carries on for much longer, then maybe everyone will need a DSE assessment. It's quite difficult because providing equipment, etc., to people at home is going to provide a challenge. One, it's getting it there. Two, it's, not everyone's home is going to be large enough for a full desk set up and chairs. So what I would advise is that if you're going to start to roll out DSE assessments, I would look at previous DSE assessments, display screen equipment, and see if there was anyone that was high risk that might need to be prioritised first. There's loads of weird and wacky sites going around, but they're actually providing some good advice, such as if you've got a separate screen, raise it on something, whether it be a sturdy box, washing up bowl, anything to try and get people to have better position, stand at the kitchen counter, stand up for a while, do work, things like that. But I would say prioritise your high risk people, go through their information first and set out an action plan. Accidents in the home has been raised, so employer's liability. So if someone does have an accident in the home, is it the employer's responsibility because they're working from home? It depends exactly what they're doing from home. I'm assuming that a lot of people are going to be doing office-related activities. I can't see there's going to be a massive amount of accidents because of that. However, if you've got people assembling stuff or doing alternative things, then that would be a work-related activity. If someone decides that they're going to go and do some DIY to fit some new light sockets for work, for their newfound office that they've created down the back of the garden, it's not necessarily a work-related activity. I do recommend that you speak to your insurers about your coverage for home workers, because your business operation has changed. So from what you were previously doing out on the road or in offices, etc., you've now got a huge amount of your workforce in the home place. So connect with your insurers. Electrical safety. So a lot of new equipment's gone out to homes, etc. Couldn't necessarily pat test it in time. You don't know about the electrical systems in your employees' houses. People are very worried. There is a few simple tips that you can do. Pat testing is only a guidance. It's actually not a legal requirement. 90% of a portable appliance test is the visual inspection of the plug and the lead and the general condition of the equipment, and then it's followed up by a test. So what you can do is advise your employees to check their electrical equipment. I've found a really good app, and I've put the link to it at the back of this, and it's from Electrical Safety First. And it's literally for people to go around their house and do little checks. So it's like, check the plugs and the cables in your bedroom, your kitchen, general overall safety. And then you've got like bedtime checks, you know, if you left loads of stuff plugged in. You could send this out in a newsletter to them. There's also one for fire safety on there as well, for people to just take extra precautions while they're at home. Mental well-being. So again, pretty similar to display screen equipment assessments. I should think mental welfare is quite tough on a lot of people. Not many of us spend this much time stuck at home, or, you know, everyone has different responsibilities and things going on. It's also a case of isolation. Stress policies still apply, and if someone does report that they're having stress, it would be the same procedure as normal, that you're doing a stress assessment with them in confidence. However, the solutions are not going to be as easy as in the workplace necessarily, but they will be different. If you have an occupational health provider specialist, I would speak to them, because a lot of the time stress assessments, etc., are outsourced to them. If you have any questions about an employee suffering from stress, etc., and you want more advice, then please don't hesitate to contact myself or Hannah. Right, okay. Hannah, can you do the next slide, please? Right, so there are still people going to work. We've seen on the news the overpacked tubes at times. We've seen the fact that construction sites are still open in places. And, you know, it's, how do you put in reasonably practical, you know, the time, cost and effort versus the risk, when you've got people that are out and about in the community where there is the higher risk of contracting COVID-19. So we're going to talk first about the safety of buildings. Again, it comes down to risk assessment. You know, things like fire are very important. You've got lifts that are potentially operational, you've got heating systems, air conditioning, etc. A lot of people are saying, you know, trades can't go into buildings to do service and maintenance, testing, inspection, but there's actually nothing in the guidance that says that maintenance and testing inspections can't continue, provided your contractor still provides social distancing and, you know, the hygiene measures required. You've got to work out how you're going to allow them access as well. A lot of people don't check what their contractors' procedures are, so before asking your contractor to come into the building, ask them for their risk assessments, ask them for a copy of their insurance. You know, for example, fire safety, people are worried that they haven't got fire marshals, or they haven't got adequate first aiders. We can go a bit more into that. But again, it's down to your risk assessment. You know, what is your fire marshal's role in the building? Some people have them go do all the checks in the building. Some people just show the people how to get to the emergency evacuation point. Each business is different. So it's deciding, is it a risk that you don't have a fire marshal? Are they responsible for anything actually critical? Do you need a member of staff that's trained to use an extinguisher? You can watch videos on YouTube, but even the fire brigade advises that you shouldn't try and tackle a fire if it's bigger than a waste basket. So should the procedure just be, okay, you can't use a fire extinguisher, get out of the building, don't even bother? There are online fire marshal courses if you want, but seriously, I'd just sit down, look at what your fire marshal's role are, decide how critical it is, and see if you're satisfied that your building might not be operating with them, or you've got reduced amounts. Okay, vulnerable people. Here's one of the biggest things about this, the vulnerable. There is a list of people that are exceptionally receptive to getting COVID-19 and dying from it. The list of diseases and illnesses is on the government website. It's not a definite, because we've heard different reports of people having different conditions or no conditions, but on an educated information, it is vulnerable people that need to be considered. So when you're deciding who works in a building and who doesn't, have you done medical health questionnaires? Now, by law, someone doesn't have to tell you they've got an underlying health condition. You can't force them. HR law comes into this, disability discrimination, etc. Each person is a case-by-case consideration. You can't just go, right, that's it. No one can come to work if you say got asthma. That's not a reasonable thing to do. It's communication all the way with people, and if you have concerns, it's talking to that person, speaking with your HR specialist and looking what the best solutions are for people. If people, you suspect they might have underlying health conditions and they're not telling you, there's not really much you can do. Speak to HR, ask them what your options are in terms of maybe furloughing people, finding alternative duties, etc. We've got lone working. People are very concerned about lone working. Like any standard lone working risk assessment, it's looking at, again, vulnerable people for medical emergencies. Is there a certain response someone would need for different reasons? Also, if your contractors are still permitted to come in your building, what's their lone working procedures? You can't provide them assistance if you haven't got enough maybe for yourself. You know, if they're going off to an isolated part of the building, to the plant room, etc., is there a way for them to raise the alarm? Does anyone know they're there? Who's checking in on them? Are they meant to communicate back to you? And it's keeping that line of communication open. Also, it's looking at what activities people might be doing that are high risk. If they're just in an office and they're typing and doing general office activities, then okay, the risk is a lot lower. If you've got people that are, say, coming in to work in your plant rooms, that's a lot higher risk, and you need to start looking at, okay, are we geared up for that? You know, does a contractor have to send 2 people? How are they going to manage that? It can get a bit tricky. Someone asked a question about first aid, if you don't have first aiders in the office. Now, there's let's bust some myths on this one. People say absolutely you have to have 1 per 50 people in an office. It's just a guidance. It's not actually true. It comes down to all those factors that I've said above. So vulnerable people, the type of building, the type of activities, you've got lone workers. You also have to consider that if you've got, say, someone that is prone to, I don't know, a heart condition, or they're high risk, if CPR was needed at this point in time, or a first aid has got to come into contact with another person, that's a risk to them, isn't it? So it would be advisable to send out a policy or some instructions for your first aiders. It may be as simple as the first aider directs the person to apply the plasters, bandages themselves. If the person has got profuse bleeding, then it's to use full PPE if they're going to have to assist that person. Each case is going to be different. You'd hope that the high-risk activities that might cause profuse bleeding had been stopped. I think I've covered fire marshals. So if anyone has got any more questions about fire marshals, fire safety, we can answer them at the end. Hannah, could you change the slide, please? Right, okay, so we talked about getting the contractors in to keep the building maintained. The HSE, Health and Safety Executive, has provided some guidance on lifting operations, lifting testing, inspection and pressure systems. And they've said where possible it should continue. However, people are facing problems with letting people in buildings, the availability of the inspectors. You know, a lot of people are furloughed or locked down, or they won't travel via public transport. You know, strange times and different times that we have to deal with. So they said, you know, well, if you can't get it tested, what should be the procedure? It's like there's other things to consider, like fixed wiring tests, there's fire alarm tests, emergency lighting tests, a whole range of different maintenance things that happen in your building that are pretty much life critical. Now, let's take lifts, for example, in a risk assessment. Do people need to be using a lift if you can't get it tested and inspected? Is it a fire lift? Could they use the stairs instead? You need to operate it. You know, keep in mind that there's the risk that if the lift breaks down, what's the call out time for someone to come and get them out? You know, all these kind of things. It's looking at your previous reports of equipment. How old is it? Is it in good condition? A lot of contractors and insurers are offering like online solutions where you can take photos, you can do videos with them, you can sense check them and help you with your risk assessment to decide, you know, if we can't get this tested and inspected, then is it still safe to run? Because I'm not a lift specialist. I couldn't go do a pressure testing and inspection on anything. So if someone came to me just because I'm health and safety and said, you know what, Liz, is this safe to run? I'd have to say I would go to a specialist. I would go and get a sense check from them and make a joint decision, or take their advice and make that decision on what my next steps were. Okay, so I've got a little checklist here. So speak to your insurers, look at previous reports for the plant and equipment, decide whether it needs to be operating. Is the equipment life safety critical, i.e. fire safety lift, your fire detection systems? You've got very empty buildings at the moment. The fire alarm, the fire detectors need to be operational to be able to provide early warning. Get competent advice from your inspection body. Find an alternative supplier. If your normal supplier can't do it, then why not try and use someone else? It's not because you don't like them anymore or you don't like using their services, it's just you need to get it done, possibly if you decide you want to carry on running it. Always check with your insurers. I keep saying this all the way through. It's been calls on different insurance bodies' websites for people to keep in touch and let them know of things that are changing all the time. On the plant and inspection, so vehicle MOTs, for example, the guidance is pretty much similar. There's been a 3-month extension, I believe, MOTs. And what they say in that guidance is that your car has to still be roadworthy, safe to use, etc. Same applies with all your equipment, etc. Yeah, so all depends just on the situation. There haven't been any extensions. I've been on different electrical bodies' websites and they've not provided any guidance on it, which is really unhelpful, but hopefully someone might, and then we can provide you an update. Right, okay. So Hannah, can I have the next slide, please? Right, so we didn't plan for this. We didn't know it was going to happen. There is business continuity planning out there. I've been involved in pandemic business continuity planning before, for bird flu, swine flu, foot and mouth disease. And to be honest, this shocked me just as much as anyone else, despite whatever planning that was ever done. No one expected this. But we do know what the future might hold now. And so I'd say not to make the same mistake twice. and get planning now, because you want to get in there with the contractors and the improvements that you want to make for your workplace. There's also going to be a lot of scheduling, a lot of planning, a lot of communication. You know, it's going to be all hands on deck, because things are not going to be normal, not for a very, very long time. You know, it's talking about phased returns to work is one of the solutions that they're talking about. But if you look on the WHO website, they've released what the factors are that would mean that a lockdown could be lifted in a country when things can start to return to normal. And one of them is about the workplaces, you know, that there is a restriction on the ability for the spread of COVID-19. So what a workplace is going to do, there will be further government guidance on it. Some of the things that I've picked out the news, if anyone's picked out more, I'd be really happy to hear it. They're talking about when things do start to improve, you know, the rate of COVID-19 infections go down, and less people are dying, that maybe it'd be phased returns to work, which might be prioritised by geographical areas. I don't know where the majority of people are coming from on this webinar, but I looked at the map of Great Britain last night, and the highest infected areas are obviously the cities. London has been hit quite hard, a lot of the home counties, and an area in Glasgow region as well. So you might find that buildings start to open in lesser affected areas. Is there a way you can base yourself? Can you get remote offices from those areas if you needed to? Bit difficult when your workforce is based in one place. Phased returns to work. People might be looking at antibody kits before, you know, successfully passing an antibody kit before they can return to work. However, the antibody kits are not certain at the moment, because the antibodies only prove that you've got antibodies. It doesn't prove at the moment for sure that anyone's immune. What it will tell us, they think, is if people have already had coronavirus and recovered from it and obviously are still alive. So it might change the viewpoint on the rate of infection, etc. But there's rumours that these are going to come out for £6 each on Amazon, and we'll have to just look at the government guidance and the different scientific information, how valuable they are on their readings. They're talking about potential vaccines or immunity passports. Well, it doesn't appear that a vaccine's in sight yet. They keep whispering about them, but we don't know how long one would take. Plan for the future, you know, so back to these phased returns, you know, how can you manage social distancing if people are using public transport, coming back into the building? Can you avoid people coming in rush hour? Can you stagger people coming into the office during the day? I saw a horrific picture on LinkedIn the other day where there was a construction site and their welfare facility, so their canteen, it's absolutely rammed to the hilt with people just all sitting next to each other. You know, there are areas that you could like restrict, not use, you know, areas where you gather. You'd be looking at, you know, your welfare facilities adequate. You know, have you got hand sanitizers? Can you get hold of hand sanitizers? Can you get hold of soap? Will cleaning frequencies be higher? I know there's been a webinar already hosted by Office Management Portal about cleaning, and you know, people will want to increase. So I'd start talking to your cleaning companies now. Reducing contact points, so you know, anywhere that people's hands touch, etc. Like light switches, door handles, taps, hand dryers, anywhere like that. Is there a way of making them contact free? You know, putting things in automatic sensors so that your hands aren't coming into contact with these things. Hot desks. Now that's going to be a difficult one to manage. Hot desks, what would you do? Would you give people separate keyboards? Would you give people separate mouse? And that is something to really consider. If you've got workers coming in that are going to be hot desking, are you going to give them their own piece of equipment to use with adequate cleaning stuff? And then there's other things like receiving deliveries. There's guidance on Public Health England. You know, who's going to receive deliveries? Where are they coming in from? Where are they going to be held? Do you remove them from the packaging before they enter the building? Who does that? Shared facilities such as kitchens and fridges, cutlery, crockery, do you just scrap all that? And then again, it's looking at your vulnerable people. Do they stay at home for the time being? Will they be the last ones to come back? Gyms. Someone asked me about gyms the other day. You know, when we start to go back to normal, obviously the gym equipment might not be great to use because obviously you've got hand contact and the cleaning, etc. But you know, people are saying, well, you could run a yoga class, surely. Like if people bring their own mats and everyone's 2 meters apart, would that be such a bad thing? Some people are even getting their gym providers to do online classes for their employees. I think that's quite a nice touch. And then there's the option of giving people PPE to come back to work. The reliability of masks isn't fantastic for numerous different reasons. If anyone wants to speak to me about masks, they can do, but we won't get into it right here, right now. Gloves are a good option, but it's once again getting hold of them, making sure they're latex free, and that people know the good practices of putting gloves on, taking them off, and disposing of them responsibly. Right, okay. Next slide, please, Hannah. Right, one of the things that occurred to me was the return of equipment that's been used at home as well. You know, everyone's got laptops in their houses. There was this thing on the internet, I can't remember which site, it's Public Health or the WHO, and it talks about the lifetime of coronavirus on different surfaces. I'm sure most of you have probably seen it in the news or Facebook or something like that. It does live for quite a substantial amount of time on plastic, metal, harder surfaces in general. So when you get the equipment returned from people's home, are you going to let them bring it straight back into your office? So fair enough point, you know, people have been touching it, people can be carriers and not display any symptoms. So what are you going to do when people bring their equipment back? We've talked about the social distancing, deep cleaning. I know that there are companies out there right now that are being commissioned to go into empty offices and they're doing deep cleans right now. Clean the keyboards, everything, carpets, what's not. When you look at who's coming back first and why, again, I said about the occupational health provider, are they fit and healthy? But the other thing is maybe finding out of your employees if they've got vulnerable family members. You know, it might be that you say it's not worth the risk of you taking something back or carrying something back to your house if they are like a carer or they've got someone in their household that could be more susceptible. So that could be another consideration. Also, age groups. Unfortunately, there is age discrimination legislation out there, which you should speak to HR about. But if it means that they're at higher risk due to health and safety reasons, there needs to be a fine balance in your decisions around that. Okay. Right, Hannah, can you do the next slide, please? Right, I've managed to actually keep it within time. I'm sorry if that was complete bombardment of information, but I just wanted to give you some pointers. It's a lot of information to take on. So I'm more than happy for anyone to call me afterwards. If you don't want to speak up on a webinar, you're a bit shy, or the questions come to you afterwards, or you just don't have a clue where to start, yeah, by all means, please give me a call. I can see from the chat bar that there is one chat already in there.
Yeah, there's a question from Claire. you want me to read it out, Liz?
Yes, please.
So Claire's asked, do you need to do a risk assessment for current COVID-19 situation or update your current one?
Has she got a current COVID-19 risk assessment?
I think she means her update a current risk assessment, so your general office risk assessment or your general workplace risk assessment.
You could probably do
that.
Yeah, you could probably do either. You can either start a new one, start fresh, a fresh COVID-19 one, or update your current office risk assessment. After all, they're meant to be working documents that you can plan your actions through. So you can do either. It's not a problem. As long as you've got a risk assessment of some form, you've complied with management health and safety at work regs. So
yeah, I mean, I would recommend, to save you probably a fair amount of time, because you don't want to remove all the controls that you'll have put in place in your current risk assessment, to save the file as a new version, and detail at the top, or save the file as reference COVID situation, the date, and then add to it and highlight the measures that you're putting in place or that you're changing as a result of COVID, and keep that file live. As Liz says, it's a constant working file. It doesn't just sit in the drawer and stay stagnant for however long until you next take it out. It's got to be a live file, and that's in normal circumstances, let alone now the situation. So keep looking at it every week, every few days if you need to, depending on the risk of your business.
It's so fluid at the moment. Yeah, so fluid with the government guidance and advice, and there's so much of it. I tried to distance myself a bit from it, to be honest. Like a lot of people have been advised to. I think we all got a little bit crazed with the bombardment of information, which I've just promptly done to you guys. But I was going through it for the past couple of days in preparation for this, and it is a bit overwhelming. There's just so much, and I think unless you've got a legal idea of how to navigate through it and what's what, it's a bit frightening for people. So if anyone does want to speak, that's fine.
I think there's probably some useful stuff there to take away, because much like the presentation you referred to that we did already, that was focusing primarily on cleaning and actions to consider when returning to work. Alan and a few other people have just talked about the laptop or personal equipment or company equipment situation that was mentioned, and we talked about this on the other call. One suggestion I made is that you almost have like a drop-off service. So the day that you start bringing people back into work, in whatever format that looks like, whether it's delayed, phased, whatever it might be, you get them to drop it off with your cleaning team, and you get extra cleaners in that day, or company like Alan's, and they start to clean it in the ways that they would, knowing that will disinfect it, and then get them to pick it up half an hour later, whatever might be suitable. So they come in, drop it off, go and have a team meeting, go and get breakfast, coffee, get to grips with the situation, and then come back. Much like I was saying, I would do almost like an upgrade shop, as an office manager, when you do bulk upgrades of mobile phones, Blackberries, laptops, whatever it be, iPads.
It's a good idea.
These businesses, you would tend to get your staff to drop them off that morning, and then they'd pick them up later on in the day once IT had turned them over to the new device.
So the last thing you want to do is all that good work, and then everyone brings in their stuff from home, and
I think that was a good idea that came out of that one. So hopefully that helps, Claire. And as Alan said, you could do what Alan said, where you place them in a secure room and leave for at least a week, but obviously that's difficult if people need to use it straight away. So you've got some options there, hopefully, that help. And I think the whole point of this webinar as well is to try and provide some information and advice, but obviously Liz and I and Alan and other people that are experts in these fields don't have all the answers, because even the WHO and Public Health England and so on don't have all the answers yet.
There's quite a few questions popping up there.
There's a lot that is still unknown. We talked about how long things, the virus will last on hard surfaces versus how long it will last on natural
there's
materials.
Various things.
And I think that's changed again. It was 72 hours, and then there were talk recently in the last week that it's actually 96 hours and so on. So it's just making sure that you start to think about these things, start with your risk assessment, probably use your existing one if you've got it, and then start to translate that into what actions you need. For anyone that is on the portal, there are some policies and action plans that I've uploaded over the weekend to help as well. So looking at so there's some other questions. I think Alex, you were just making a comment off the back of Claire's one there, so I think we've covered that. Gabriella has asked Liz if you can share, perhaps in the chat, you can type it into the chat for us. The app, check for the PAT items that you mentioned earlier on. That app that you mentioned.
It's in the links. It's in the links. If
okay.
Hannah moves forward the page on the webinar, and so there's my contact details, and then I've put all the links here. So there's the electrical. Where's that page gone? Oh, hang on. Sorry, I'm having a bit of a technical wobble. 1 minute.
That's right, Liz. Do you want to just put the link in the chat and then everyone can access it from there?
I can't. It's I can't right now. I'll have to come out of my screen, so I can send them afterwards.
It's fine. I'll put the link in the chat in a second, everyone. As well. You'll get these slides after as well. We'll send them round.
Where is it?
Well, hopefully that's
answered my screen.
Hopefully that's
it's really good. I forgot to mention the first aid app. So when I've dealt with mobile workers for trades, etc., in the past, where they're all like out in their vans all day, you obviously can't supply everyone a first aider. It's not practical, and there's no courses in self-application first aid for some bizarre reason. But the first aid app that's listed on there, it's a Red Cross app. You can also get a St John's Ambulance one as well. They're free, and they've got loads of videos and advice on first aid, what to do in different circumstances. So they're really useful. I've always recommended them for people that have limited access to first aid, because it's not always practical.
Okay, I've just put those links in there now, so that hopefully will help as well. But yeah, we will send these slides around and I'll upload them to the portal as well as this recording. So I know a few of you come in quite late, so you'll be able to start it again from the recording that I'll circulate. So Zar has said, can we add over 60s to the vulnerable list as to people who are allowed to work from home even after the lockdown is listed, or will that be considered as age discrimination?
I believe, and go seek further advice from HR providers on this. I do believe that if it's in the interest of people's safety first, disability discrimination and age discrimination sort of go out the window a bit on that. But you would have to follow a process, and you would have to do the consultation with people and tread quite carefully, because some people might be offended, etc. And it also depends on their health. You know, you can have a very healthy 60-year-old and not so healthy 60-year-old, like any age group. So yeah, I'd consider it. Also, there's rumours that when we do have phased returns, that the government, the lockdown will be lifted first for young people anyway. So it might be out of your hands to make that decision. We'll just have to see.
Yeah, and I think that comes back to risk assessment and what work it is that you do. If you're at an office, which I know generally Zara, you guys are, I think it's considering what the risks are to them and what the advice is at the time. But yeah, do it in consultation with HR. I don't think that by considering who is more at risk here, you're discriminating in any way. You know, I know that there was some talk recently about, and some of the figures were showing about you know, different ethnicities in terms of who this virus affects more, and they don't have the answers to that yet. But it might be that, you know, different ethnicities are affected differently, and therefore they're higher risk. And I don't think you're discriminating in any way. All you're trying to do is assess who is most vulnerable here. But yeah, follow the process, do it in consultation with your employees when decisions have been made, and make sure you're being fair across the board so that you're not discriminating in any way. So if it is over 60s, it's all over 60s, unless they've got some sort of exception and you've advised others of perhaps what that is, so that you are being seen to be fair, even if perhaps you can't be entirely fair. Helen, sorry, has said we're all laptop users, so would you suggest a policy once laptops are in the office, they need to stay in the office, and how do you manage people taking them home if not? I think that's a really good point there.
Yes. You could, laptops are difficult because, I mean, Alan is the cleaning specialist on here, but, you know, it's easy with laptops for sort of contamination. There's been like loads of studies prior to COVID-19 about how many germs are on the average laptop, phone, etc. You could provide people cleaning equipment that are meant to clean the stuff with themselves, seek further advice from a cleaning specialist, or you could say to them, leave your laptops at work, you're not to transport them to and from. If people choose to ignore it, so you said, how do you manage people taking them home? Well, you've got to instruct and inform them first and tell them why you're not to take laptops home. If they fail to follow that advice, a HR colleague of mine the other day said, you know, that actually constitutes as could actually constitute as gross misconduct under HR legislation. And so, you know, that could lead to an investigation and further disciplinary with an employee. I'm not a HR specialist, I've got a rough idea of it, but that would be it. And it's same with anything where you're giving out safety instructions. If a member of your staff doesn't follow what you're asking them to do, they basically, you know, you can go down disciplinary routes.
Yeah, essentially, like the Health and Safety at Work Act doesn't just apply to employers, it applies to employees as well. And yes, I think that's the case with any health and safety. It's their responsibility to maintain the health and safety and well-being of themselves and of other people at work and their colleagues by any actions that they take. So if you put a policy in place that says once you have returned to work with your company equipment, be it laptop, be it iPad, etc., you cannot then take it home, I would say, with the exception of probably something like their mobile phone. Then and if they, you know, deliberately and blatantly ignore that instruction after you've sent it very clearly and communicated that, then yeah, you can take them down the disciplinary route.
Can I also add another little bit of a piece of legislation that not a lot of people are aware of? It's called vicarious liability. So if you know what vicarious liability is, then fantastic. But what vicarious liability is basically the employer is responsible for the actions of their employees. I'll give you an example that's not related to COVID-19. It's a bit of a crazy story. I couldn't believe it, but it actually stood up in court based on vicarious liability. So there was somewhere like a Tesco's garage, or it was Waitrose, something like that. And a customer turned up, went into the shop, got into an argument with the employee. The employee abused him racially and whatever else and was verbally abusive, and then he throws him out onto the forecourt and he beat him up. Like, customer service at its best, not. But you think, right, okay, well, do I have to inform my staff to not go around beating up my customers? But it was held up in court that Tesco's was vicariously liable. I'm not sure if it was Tesco's, one of them was vicariously liable for their employers' actions. I also didn't say that we've talked about criminal law a lot, that there's nothing from the insurance world about any personal injury claims related to COVID-19 either yet. So yeah, please get those risk assessments in place and just document everything you do.
And Liz, you were sent a couple of questions on email, and I know I sent one on from Rachel. I'm not sure if she's still on the call.
Hope I covered it. It was to do with, is Rachel still on there? I don't know.
Yeah.
She said about first aid and fire marshals, I believe. Let me just have a look. 1 minute. Got so many emails from you, Hannah, I can't keep track.
That's all right. So I just wanted to check that Rachel's happy it's been covered. So yeah, you're happy, Rachel. So that's fab. That's been covered.
Good. All right, lovely. Okay, that's really good. So cool.
All right, are there any other questions from anyone at all? Feel free to raise them in the chat or unmute and say hello. No? Okay.
No? Wonderful,
If not,
thank you.
If not, Liz's details are in the slides, so I'll send them round. The recording will come round and we'll upload it to the portal. There's obviously a live topic in the forum in the portal as well on this. So if you think of something later, or if you're watching this back on playback because you weren't able to join live, then feel free to raise it in the forum, and Liz is there so she can help answer, and I can as well. So thank you so much to Liz. Thank you for joining, everybody.
Thank you.
Stay safe and we'll see you soon.
See you all. Bye.
Bye now.
Thank you. Bye.
Bye.
Thanks. Bye.